A U.S. study finds that patients and their families are rarely told when hospitals make mistakes with their medicines. And they also found that most of the mistakes are being made in the intensive care units where the patients and the families are less likely to be told. Now, to err is human, so medication errors are expected to some degree, but how many are really being made and how do we prevent them?
Yeah, that's a real problem because medicine is very complicated, Vicky. And a lot of what we do in medicine is experimental. When we are combining drugs together, 5, 10, 15, 20, sometimes 30 drugs for people who are sick and in the hospital, that's an experiment because we have no data on combinations of therapy like that that will tell us if they're safe or not.
And nobody really wants to make a mistake. And when the healthcare workers do make a mistake, like the nurses or the doctors or what have you, I mean, they feel terrible.
Sure.
But it's kind of scary for them, to tell and to report it because
Right.
it's a big deal. There are incident reports that are supposed to be made, but they did do a study that showed that when, what's it called, when people when it's a blame-free report, in other words, when nobody knows who did it,
Right, it's anonymously reported.
yeah, then there's a lot more that are obviously reported.
Yeah, but even when it's anonymous, it's not safe. And the problem is that when you've made an error and somebody suffered from it, you're open to a lawsuit. Your colleagues are going to know. Your hospital's going to get after you. You may lose your license from your medical board. So it's a big deal. Now, a study was done in critical care medicine in January 2013 at Johns Hopkins University. And it looked at 840,000 voluntarily reported errors over a period of 6 years and at 537 hospitals. And that comes to about 261 errors per year. Now, that's not very many errors when we know that thousands of people are dying in hospitals from errors. We know that a study done in September of 1997, okay, it was a very popular study in the Journal of the American Medical Association, showed that there were 106,000 deaths from the expected side effects of medications. And that didn't include all the errors that are made. So you can bet that this number is underappreciated.
Well, and then also the Institute for Healthcare did a report, and they showed that there were 90 times more errors by practitioners than were admitted. So we know that there's a lot more,
Right.
but nobody seems to know how many because people don't report them.
Well, that shouldn't be a surprise for the reasons that I just mentioned. So is it a surprise that we have all these errors going on in the hospital? No. And like Vicki says, to err is human. And when medicine is complicated as it is, that's just part of the deal. We have to remember that people who come into hospital are desperately ill very often go home and they're just fine when they're done. So we have to have a lot of respect for our doctors and for the medications and the technologies that we have. Errors are part of the deal. The real solution, don't get sick. We should do more lifestyle medicine. If we can keep people doing things that are good for their health, chances are they're not going to be in the ICU or having problems that require lots of medications.
And hospitals are trying to do things to reduce the amount of errors. Now they have like these barcode scanners for the patients.
So at least you don't give it to the wrong person then.
Yeah.
That's a good start.
Yeah.
But all the other things, I mean, nurses are busy. Look how busy nurses are. Remember when you were a nurse on the floor and you were behind a lot of the time because you didn't have enough time to give to your patients? I mean, that made a big difference. And so
and you're interrupted, and
Sure.
you never know what can happen.
Sure, you can make a math error. You can give the wrong drug to the wrong person. Lots of ways to go wrong. So there's still more we could do to improve healthcare by giving more time to our nurses and to have the pharmacies check things as they are. But in general, the disease care model leads to stuff like that, and that's just part of the deal.